Hello, welcome to Gyne4You. I am Mr. Bedoya Ronga, consultant gynecologist. Today we're going to talk about heavy menstrual bleeding. This is a very common problem that affects 20 to 30% of women in reproductive age, and it represents the fourth more common cause of visit to the gynecologist. Let's try to define it. There is a definition that says it is a bleeding larger than 80 mils and for more than 7 days. This is quite complex and difficult to measure and quantify. So our preferred definition is the one that states that heavy menstrual bleeding is excessive menstrual blood loss that interferes with women's physical, social, emotional, or material quality of life. Basically, when you tell us that bleeding is affecting your quality of life, commonly there are other symptoms, such as a feeling of tiredness, especially around your periods, lack of energy. When there is associated anemia, patient can feel really dizzy and even require blood transfusion. When you pass clots, it's very common to experience cramps and painful periods. Let's talk about how things works. Within the womb, there is the lining of the womb. And the lining of the womb grows and it's shed every month. There are two hormones that are produced by the ovaries, estrogen and progesterone. Estrogen makes the lining of the womb growth. Progesterone makes the lining of the womb to be ready for the implantation of a pregnancy. At the end of the month, when there is no pregnancy, progesterone drops and the lining of the womb is shed. Why patients have heavy periods? In around 50% of the cases, we don't find the cause, and it's likely to be related to a hormonal imbalance. Something to bear in mind is that fat does produce estrogen too. So ladies who have an increased body mass index will have an excess production of estrogen, and ladies who are thin, have got a very low body mass index, might have a decreased level of estrogens, and those can contribute to abnormal periods. Other times we do find a cause for heavy periods, and this can be polyps. Polyps are like skin tags of the lining of the womb. Endometrial polyps are not commonly malignant, but they do need to be investigated. Other common causes are fibroids. Fibroids are tumors of the muscle of the uterus. Fibroids are not commonly malignant, and they can be left alone without treatment unless they are generating any problems. Another cause is adenomyosis. Adenomyosis is the lining of the womb growing inside the muscle of the womb, and this is usually associated with quite painful periods and pain with intercourse. The intrauterine copper device used for contraception, it is associated with slightly heavish periods. Then we have metabolic conditions like polycystic ovarian syndrome, which is associated with prolonged periods without bleeding, and then heavy bleeding. Other causes of heavy menstrual bleeding can be thyroid problems or coagulation problems like von Willebrand disease. Cancer of the lining of the womb can give heavy periods, and in patients with risk factors it is particularly relevant. We exclude it. What investigations we would like to do? In terms of blood tests, we would like to check your iron level, and also we may check your thyroid hormones and sometimes clotting factors for von Willebrand disease. The clinical examination is essential, and we will start checking your tummy, looking for lumps and bumps and areas of pain, and then you will require an internal examination. Through that, we will make sure we're not overlooking a vaginal or cervical cause for your bleeding, and at times we may take a sample of the lining of the womb for reassurance. Nowadays there are two tendencies. Some gynecologists would prefer to start investigations by doing what is called a hysteroscopy, camera inside the womb, to check for abnormalities like polyps, submucous fibroids, and a targeted biopsy or treatment of those polyps or small fibroids. Other gynecologists could prefer to do a pelvic ultrasound scan, preferable an internal scan, because that is the one which would allow us to see the lining of the womb in more detail, looking for polyps, for fibroids, and for adenomyosis. Once we have finished the investigations, you need to decide, what would you like to do? Many times, watchful waiting is acceptable once we have excluded serious pathologies. Other times, you might prefer to do something about it. Let's start with a medical treatment. You could take tablets which are non-hormonal, which will make your bleeding lesser. These tablets are called tranexamic acid and mefenamic acid. The first will reduce the clots that you produce. The second will make the bleeding lesser. Those tablets are taken only during your menses, and they can upset your stomach. This treatment is particularly relevant for patients who are trying to conceive, as it does not interfere with the ovulation. Other type of medical treatment is the hormonal treatment. Commonly, gynecologists prefers the levonorgestrel intrauterine device. The reason is because it's very effective. Other progesterone treatments are also an alternative, like the mini pill, the implant, or the injection, Depo-Provera. If there are no contraindications, you could also have the combined pill. With regards to the progesterone contraception, it can give bloatedness, breast tenderness, and occasionally can affect your moods. Then you have the surgical options. And the surgical options range from a relatively low risk one, which is called endometrial ablation, which is the burning of the lining of the womb, to a big surgery which is called hysterectomy, removal of the womb, with or without the neck of the womb. In general terms, surgery carries on the risk of infection, bleeding, and damage to the organs nearby, which are bladder, bowel, ureters, and big vessels, carrying on risks of damaging these structures and requiring further surgery to repair. Occasionally, surgery can lead to pain in the surgical site that may last for long periods. The hysterectomy can lead to damage of the nerves that regulates the bladder and bowel function. Although this is not common, it can happen. The hysterectomy can be done through different routes. It can be done keyhole, laparoscopic hysterectomy. It can be done abdominal through a cuttingectomy, or vaginal from down below. And depending on your circumstances and your gynecologist's expertise, one or other might be preferable. Surgery also carries on the risk of clots in the legs and clots in the lungs, and a small risk of death. That is why we try to favor a stepwise treatment, starting from medication, then moving to ablation, and leaving the hysterectomy for the last resource. I hope you found this video useful. Please do let me know your comments. Thank you.